Hi everyone, my name is Fateha Zannath. I am a junior at Johns Hopkins University studying public health studies and economics, and I had the pleasure of being a Margolis intern this summer, and I wanted to take a couple minutes just to reflect on my experience and share some of my key takeaways working with such an incredible group of interns this summer. So I think really I wanted to start off with sharing that I'm a first generation college student from a low income family, and figuring out my niche in terms of studying different majors in colleges was super important to me because I didn't really have anyone to look up to and learn in depth about different subjects. So when I stumbled across public health, it really connected with me, and a lot of the principles about social justice and health disparities were things that really connected with me because growing up, I had so many instances of really witnessing firsthand diagnostic disparities or diagnostic errors or medical racism. So I knew public health was something that I really wanted to focus and devote my career towards, but I really didn't know how to get the hands-on experience with different kind of intersections in public health, such as health policy. So when I first came across the Margolis summer internship program, and I learned that some of the key components of this program is learning about social justice and healthcare and learning how to apply those principles to health policy, I was really interested in applying to this program because I wanted to enrich those fields of knowledge and couple it with the classes that I'm taking at Johns Hopkins to kind of enhance my understanding of public health and how to include health equity and race at the forefront of health policy. So all those components from the journal club, looking at different facets of health disparity and health inequities, and applying it to literature, and our projects that we're working on this summer to the actual project themselves. My specific project was looking at diversity of clinical trial participants and their racial compositions for cancer drugs with breakthrough therapy approval, and looking at the inequities in that project and coupling it with learning what other interns are doing. I was able to really expand my interests within health policy and learn that it really is a layered discipline. It's not just looking at law and looking at a problem and putting two and two together and implementing change. It's really looking at it from an economic lens, a political lens, a social policy lens, even from the lens of healthcare delivery. So ultimately, seeing how multifaceted health policy is, I now know that it's something that I'm truly interested in, and it's something that I want to move further on with in my career. And I don't think that's a realization I would have come to had I not participated in this internship. And I think being an intern in the Margolis Center has been such a different learning experience from other opportunities I've had the chance to participate in, because there were just so many moving components in this internship to make sure that we were learning about health policy from every lens possible, from fireside chats with different professionals in the industry to what I mentioned earlier, the journal club, or poster presentations, or joining in on team meetings, because it wasn't just one task that I was doing every day. I always felt like I was learning from a different medium about health policy, and it helped me kind of figure out how I like to learn and how I like to engage in a team. What I realized is that sharing different progress points within my project with other interns, regardless of if they were working on similar projects or not, was really helpful to get diversified perspectives and insight on how I could better my methodology for my own project. I think before this experience, I was under the impression that I needed to work with like-minded people, or that in order to make sure my project was successful, I needed to kind of share progress updates with people that were working on similar projects. And because I was able to seek opinions from interns that were working on projects that deal with intimate partner violence or food systems or even environmental health in North Carolina, I was able to get really diverse perspectives on how to include other races in clinical trials, or just different key questions that I hadn't really considered previously, such as the social and economic backgrounds of different patients. But ultimately, I think being an intern at the Margolis Center has been really rewarding because amidst COVID and working remote and taking remote classes, I was really scared that I was going to miss out on a summer where, I could have been interning and networking with different people and health policy so that I could build that foundation. And I was scared that with even a remote internship, I wouldn't really learn any skills because, we're all isolated from each other and we don't have that in-person contact. But I think being a remote intern at Margolis, everyone from the program coordinators to my mentor, Dr. Kim Lyerly, to other teammates, they've done such a great job at maintaining connection and getting to know one another through weekly check-ins or group socials or group chats where we get to kind of share our interests and what we're working on beyond this internship experience. I think that has been really rewarding, just getting to know a whole other body of students that are just as interested in health policy through different lenses like me. And I think although it was challenging to be an intern remote, especially as a student that's not in the Duke ecosystem, I think just being able to participate in different projects and being able to participate in different group socials help make this experience one that will, last a really long time in terms of its impact on how I navigate my career in health policy. And I'm really excited to continue working with Dr. Kim Lyerly and Natalie Wong, who is my peer on this project. To gather more data about diversity in cancer clinical trials and hopefully help create some policies to ensure that historically marginalized communities aren't being left behind in different facets of the clinical trial process and treatment, especially for novel cancer drugs. So I am really grateful for the opportunity to be a Margolis intern this summer. And I really do hope that this program continues to be a way to impact other students who aren't sure how they want to navigate their career in health policy, but are interested in learning more about the field, especially through an equity lens. So thank you so much for the opportunity to be a Margolis intern. It's definitely been one of the highlights of my summer and one of the highlights as a public health student.